Welcome to Emergency Insights. I'm your host, James Carter. Today, we're diving into the common causes of hyperthyroidism, a condition that every healthcare provider should be familiar with given its significant impact on patient health. The most prevalent cause of hyperthyroidism is Graves' disease. This autoimmune disorder is characterized by a diffusely enlarged thyroid gland, the presence of thyrotropin receptor antibodies, or TRAb, and often ocular manifestations such as exophthalmos, proptosis, and ophthalmoplegia. Additionally, some patients may develop pretibial myxedema, a skin condition associated with Graves' disease. In elderly patients, toxic multinodular goiter is a common cause. Unlike Graves' disease, this condition presents with individual lumps in the thyroid gland, and a thyroid nuclear scan will reveal hot nodules. Another cause is thyroid adenoma, which involves a single hyperfunctioning nodule that also appears hot on a nuclear scan. Multinodular goiter, on the other hand, features multiple hyperactive nodules. Inflammatory conditions, such as subacute thyroiditis, often triggered by a viral infection, can also lead to hyperthyroidism. Patients with this condition typically present with a tender, painful thyroid gland. Painless thyroiditis, a variant of thyroid inflammation, can similarly cause transient hyperthyroidism without the associated pain. Factitious hyperthyroidism is another important consideration. This occurs when a patient intentionally or unintentionally takes excessive thyroid hormone, leading to hyperthyroid symptoms. Rare causes of hyperthyroidism include amiodarone, a medication that can induce either hypo or hyperthyroidism, and TSH-producing pituitary tumors, which stimulate the thyroid gland excessively. Thyroid carcinoma and struma ovarii, an ovarian teratoma that secretes thyroid hormone, are additional but less common etiologies. Understanding these causes is critical for accurate diagnosis and effective management of hyperthyroidism. That's all the time we have for today. Thank you for listening, and we'll see you next time.